Okay,
Okay, here we
welcome
go.
everyone. We may have some people come in later, and I'm not going to review everything for them. We're going to do a presentation on Medicare and give you some understanding of Medicare health plans and Medicare itself. My name is Paul Davis. I'm a licensed agent. I've been in business 35 years. And for the last 12 years, the focus of my practice has shifted to where I'm only doing Medicare health plans. That's the only market we're working in: people turning 65, people leaving group health insurance, people moving from other states. The only thing we're helping people with is Medicare and Medicare health plan options. I've asked if you can put in the chat box, it would be helpful and useful to us. Any comment about why you're attending this presentation and what you hope to get out of it. And then before you leave, if you can give us a quick comment on whether it was what you thought it would be, what you wish you would have heard that you didn't, any feedback such as that. And in future, we'll probably try to do some polling and get some interaction, but we're not quite up to that level of technology yet. This is only about the 5th webinar that I've done using Zoom. So if we stumble a little bit, cut us some slack, because we haven't done this that many times that it's second nature yet. So my background, I've been voted best insurance agent by readers of the Daily News for 19 years in a row. I've been named a trusted advisor by the San Fernando Valley Business Journal. And I've been a member of the National Association of Health Underwriters since 1993. So why that's important is I've had vast experience in group health insurance as well as individual health insurance. So I'm very equipped to help people transition onto Medicare. And in many cases, tell them you shouldn't transition onto Medicare, you should stay on your group health insurance plan. I've also been an affiliate member of the Southland Regional Association of Realtors since 1993. And I'm very active in the community and member of 5 chambers of commerce, FICA, member of a Rotary Club, and have been recognized for my volunteerism in the San Fernando Valley. So if you have a question, put it in the chat box. And my associate Jerry is also on the line, and he'll either answer the question directly, or if it's something complicated, he might suggest give us a call later and we'll discuss it further. Or he'll save the question to the end of the meeting, and then we'll go through Q&A at the very end. If possible and if relevant, indicate the slide number that your question relates to, and that will help us go back and track it and answer the question as best as we can. Okay, so we know the nuts and bolts of applying for Medicare and Medicare health plans. And I've had a couple people that I showed this slide to that says, and you guys had a couple of loose screws as well. So Jerry, can you laugh and make sure I'm funny today?
Sure.
Very good. All right, on cue. Thank you. And Jerry is an associate. He's worked with me for 4 years now, and he's my right-hand man. And he knows just about everything about this as I do. He's also my expert on Medicare Part D prescription drug plans. He knows more about that than I do. So some people call me an insurance guru when it comes to Medicare. And so I like to share this little cartoon. It makes me laugh every time I look at it. I'm not sure that I know I don't know everything about Medicare, because I get a question every 7 to 10 days that is a new one to me. But I've had so many questions asked, and I know the answers to so many of your questions before you're even formulating them. Okay, so Medicare health plans. And Medicare, every single person we talk to has some confusion about Medicare. The government thinks they made this easy and simple for people to grasp and understand and navigate. And my experience so far suggests that that's not quite the case. So we find a great need from people that need our assistance in dissecting this and figuring out what best to do. So one of the things I wanted to touch on at the beginning was Medicare planning for people on the move. So if you guys are buying, helping someone buy or sell a piece of property, I have a number of clients, steady trickle that's moving out of California to other states. I've gotten licensed in 13 other states as a result of following those clients. And there's some things that you might want to bring to the table when you have someone moving that's Medicare age or older. So we suggest before someone actually moves, think in advance where they're going to move to and take a look at what the health plans might be where they're moving to. We have a lot of people in Southern California that are in a Medicare Advantage HMO plan, and they're now contemplating a move to some other state where that plan does not exist. So I've had one person that actually, based on my advice, slightly altered where they were going to end up because the original zip code they chose had not very good options for health plans, and another zip code that was adjacent had some much better options for health plans. So it's something to try to factor into that. And most people don't think about this until way after the fact. I get calls from people, so I want to let you know about a move. Okay, when's it happening? Oh, we just moved. It's a little late for me to do some changes. If they're still in California and we have advanced knowledge of a move, we might want to take advantage of the California birthday rule and move them to a different plan that's more suitable to the state that they're going to. And we can also look up plans available in that zip code. You cannot continue your Medicare Advantage HMO plan or your Part D plan if you move out of the service area. And that could be moving out of LA County to another county, or moving out of California, or someone migrating from another state to California. You've got a 60-day window to make that change. And after you make that change, then you should notify Social Security of a change of address and enroll in new plans. If someone has a Medicare supplement plan, they can move to any state in the union and continue the same coverage. Sometimes the same rates based on California. Sometimes it's re-rated to the state they're moving to, which is why we want to take a look at that. Okay. If you have questions, want to explore further what information is available, this is my website, and you can see I've got a lot of helpful links to different documents, some of which we'll be sharing with you today, but lots of information out there. I've tried to make it easier for you by narrowing the plethora of documents that are available down to those that might be pertinent for someone that's taking a look at transitioning onto Medicare. And one of the documents in there would be Medicare You. You can download the PDF or the link and print it out or order one. And this is sort of a how-to manual for people that are embarking on Medicare or are already on Medicare. So one of the things I like to talk about first with people, because it's usually new information to them, is not everyone pays the same amount for Medicare. Medicare Part A, for most people, you have no cost, assuming you paid into the US economy taxes for at least 10 years. Part B, most everyone pays $144.60 a month. You can see that on the chart here, but there's an income component. So if in the tax year 2018, your modified adjusted gross income was more than $174,000 filing jointly or $87,000 filing singly, then you will pay more for your Medicare Part B. And this is what they call an income-related monthly adjustment amount. Now, that's always on a 2-year look back. So right now it's based on 2018. As of January 1st next year, it will be based on the modified adjusted gross income in 2019. In addition to this cost for Part B, you're also going to have an income-related monthly adjustment amount for Part D as in drug, whether it's a standalone Part D prescription drug plan or part of a Medicare Advantage plan. And you can see these are the additional incremental costs that you're going to incur on top of the cost for Medicare Part B. Again, if your income is below the $87,174, you're going to pay $144.60 for Medicare Part B and nothing additional for Part D. I encounter people all the time that they get the bill in the mail and they're paying way more than $144.60 a month, and they want to know what they can do to change it. There is a simple appeal process. There's a form, it's right here on the slide, SSA 44, and there are some specific boxes that you would have to check off. Marriage, divorce, annulment, those are specific things that if you can check one of those off, most common is someone is no longer working or they're working much reduced hours. They submit that form and some documentation if they can, and there's an excellent chance that they will reduce that income-related monthly adjustment amount. And I've had some people that are very grateful for my help in pointing this out to them. Okay, so I want to talk about Medicare basics as a point of reference. Again, every person I talk to has some confusion about Medicare and Medicare health plan options, so we want to have a basis of understanding. What is Medicare? So it's a federal health insurance program run by CMS, part of the US Department of Health and Human Services, and qualifications for Medicare. So mostly you're looking at people that are 65 years or older, and people often get confused with Social Security eligibility and Medicare eligibility. Medicare is 65 years or older. or if you've been disabled for more than 2 years and receiving Social Security disability benefits, or if you have end-stage renal disease or ALS. Those would qualify for you. You'd qualify for Medicare under age 65 if you fit one of those circumstances. You need to be a US citizen or a legal resident for at least 5 consecutive years. So Medicare Part A covers hospital, skilled nursing, hospice care, and home health care. Again, for most people, there's no cost. However, if we've got someone that's recently transplanted from another country, they've come here to join their children, they have to buy into Medicare Part A, and it can be as much as $458 a month. Medicare Part B covers doctor visits, lab work, x-rays, ambulance rides, durable medical equipment, chemotherapy, radiation therapy, a whole plethora of things under Part B. Again, the cost we've already gone through. Most people right now are paying $144.60 a month for Medicare Part B. I'm not going to go through everything on here, but if all you have is Medicare Parts A and B and nothing additional, then you do have some significant cost exposures. If you're hospitalized, it's a $1,408 deductible. That will cover you for the first 60 days. If you're in the hospital longer than 60 days, then it ratchets up to $352 or $740 per day. And Medicare will only cover up to 150 days in the hospital. I have had clients that have needed to be in a hospital longer than 150 days. And fortunately, they had a supplement that added to that. There's also copays under Part B. You have a $198 deductible, and then you have a 20% share of cost for additional services. So enrolling in Medicare, option one used to be you'd go to a local Social Security office. Right now they're all closed, and I haven't heard yet when they're going to be reopening. Option two is apply online, and it'd go to ssa.gov. There's a specific link, and you can see it here, and it's available on my website, and I can email it to you if you need it, to apply online. The third is to call Social Security. I've gotten mixed responses from people as to whether they've been able to do the entire enrollment online or over the phone, or it required them to send something out. I have had some people where they've called, made a phone appointment, and someone has called them and actually enrolled them. So because of COVID-19, there's some added flexibility. Your 7-month initial enrollment period starts 3 months before your 65th birthday, includes the month of your birthday, and the 3 months following your 65th birthday. So you have 7 months to enroll in Medicare Parts A and B. An example, if you turn 65 May 6th, your open enrollment period starts in February and goes through August. There's a little wrinkle to it though. If you apply in February, March, or April, the coverage is going to start May 1st. If you apply in May, the coverage starts June 1st. But if you apply later, for instance, if you wait till August to apply, they push it off several months beyond that, so you don't actually enroll until November 1st. So some people that have been a little lazy at getting around to this, anyone you know that's turning 65, say, you really should look at this like before you turn 65 to make sure you coordinate things the way you should. And if your birthday is on the 1st of a month, you get it backdated by 1 month. So May 1st, you have an effective date of April 1st. There are special enrollment periods for Medicare, and this is typically when someone has been on a group health plan, working past age 65, and now they're reducing their hours or they're retiring, and they get a fresh enrollment at that juncture, special enrollment to enroll just as if it was brand new at age 65. They've got 8 months after enrollment or the group plan ends to enroll in Medicare. But be very careful about that 8 months, because if you wait that long, you might have missed the opportunity to enroll in some other benefits. So there's a general enrollment period for Medicare. Typically, this is used by people that missed their window, didn't get around to it, forgot, and then they've got to wait till the following year, January 1st to March 31st to enroll, and their coverage will not start until July of that year. If you do that, there's a really good chance you're going to incur a late enrollment penalty with Medicare Part B, and that's a 10% penalty for every year past age 65 or past your group health insurance coverage, and you'll be stuck with that penalty for the rest of your life. So we really encourage people to avoid getting stuck with that penalty. So who needs to enroll in Medicare? If you're under age 65 and you've been on Social Security disability for more than 24 months, you'll get enrolled automatically. If you're turning 65 and you don't have health coverage, or you have an individual health plan, you absolutely should enroll in Medicare at that juncture. You will lose any subsidy you have by virtue of the fact that you become eligible for Medicare, and you don't necessarily even have to enroll. And we've had some people with big tax bills because they neglected to enroll in Medicare when they turned 65. If you're on a group health plan and it has fewer than 20 employees, then Medicare is considered to be primary and the group secondary. So someone on a smaller group plan should also enroll in Medicare Parts A and B. Who does not need to enroll in Medicare at age 65? If you're on a large group plan, more than 20 employees, and they have attested that their prescription drug coverage is creditable for Part D, you get a notice every year in the fall from the insurance company saying our coverage is deemed to be at least as good as Part D. That means it's credible. Then you can stay on that group health plan indefinitely, not have any penalties, and then when you eventually retire or leave the group health plan, you'd be able to enroll in Medicare Parts A and B and whatever additional coverages. So once you have Medicare, and this is where we come into play, once someone is enrolled in Medicare Parts A and B, then we look at what other options we would layer on top of that to fill the gaps and make their benefit package a little richer. So I like this graphic. So there are several options. So on option number one, you've got your Medicare card with effective dates on Part A and B. And someone might just say, you know, I don't want to add anything else right now, or my doctors, they don't take any of these plans. I'm just going to add a Part D prescription drug plan. That's one option. Second would be they've got original Medicare and they want to fill the gaps in Medicare and have a richer benefit experience. So they add what's called a Medicare supplement plan, also known as a Medigap plan, and a standalone Part D prescription drug plan. And the third scenario is where someone enrolls in what's called a Medicare Advantage plan. That's where you're assigning your benefits to an insurance company that becomes your provider of Medicare services. And those plans typically include a Part D prescription drug plan. On any of these options, you still need to continue to pay your Part B as in boy premium. So Part D is a prescription drug benefit that came around in 2006. It's a partnership between the federal government and a number of insurance companies. In California, we have 32 Part D prescription drug plans available. They vary immensely, different copays, different deductibles, different monthly premiums, different lists of drugs, different drugs on different tiers of formulary. So we typically will shop that for someone and figure out which is the best Part D plan for their particular circumstance for that given year. And then we reshop it all at the anniversary, the annual election period. So you can obtain prescription drug coverage on a standalone basis or as incorporated into a Medicare Advantage plan. Medicare supplement plans, these are the types of plans that I most commonly recommend when someone says, I don't want an HMO plan, and I've got a doctor over here I see at Cedars, and a doctor here I see at UCLA, and another specialist I see here, and we're going to be traveling throughout the country or spending time with my children in Tennessee. I want flexibility. So Medicare supplement plan lets you access Medicare contracted providers anywhere in the country, so it's an enormous network. There are a number of specific Medicare supplement plans. Currently, Plan F is the richest plan available, but it's only available to you if you turn 65 before January 1st of this year. And that plan has no deductibles and no share of cost as long as you're seeing Medicare contracted providers for Medicare covered services. So again, this is the plan that you want to go with if you want a great flexibility of the providers that you're going to have access to in Los Angeles and California or throughout the nation. You must be enrolled in both Medicare Parts A and B in order to enroll in a Medicare supplement plan. And these are also known as Medigap plans. Same exact thing, Medicare supplement, Medigap, same thing, same two terms to describe the same thing. Medicare Advantage plans are where you're assigning your Medicare benefits to an insurance company and they take over and become your provider of Medicare services. In Los Angeles, most of these plans, all but one, are HMO plans. Most of the plans have no monthly premium. They also have zero copays to see doctors, to get lab work done, for hospitalization. So there's minimal out of pocket. but you have to stay within their network. When you sign up, you pick a primary care doctor, and that doctor will refer you to other specialists and services within their medical group. And if you're not happy with that doctor, you can change to other medical groups, but you have a constrained group of doctors that you're going to have access to if you're on a Medicare Advantage plan. You, again, must be enrolled in Medicare Parts A and B. Many of these plans have a variety of ancillary benefits such as vision, hearing, dental, chiropractic, personal emergency response systems, over-the-counter allowances. So they've enriched a number of these plans with extra benefits on top of the basic health benefits. So when can you enroll in these plans? So when you first become eligible for Medicare, it's the same thing. 3 months before, the month of, and 3 months after, you can enroll in a Medicare Advantage and a Part D prescription drug plan on a guaranteed basis. You cannot be turned down. You can't be charged more. There's no restrictions on what's going to be covered. On a Medicare supplement plan, you've got a 6-month window from the time you start your Medicare Part B as in boy that you can enroll on a guaranteed basis. Annual election period. So every year there's an open enrollment period between October 15th and December 7th. Technically it's called the annual election period. Many people call it the annual enrollment period. Same thing. Goes from October 15th to December 7th. You can sign up on a Part D plan or Medicare Advantage plan if you hadn't signed up on one previously. You can change your Part D plan. You can change your Medicare Advantage plan. You can move from a Part D plan to a Medicare Advantage plan. There's a variety of things you can do during this time period. This is when we review all of our existing clients and bring to their attention potential changes they might want to make in their coverage. It's I tell Jerry it's like tax season for accountants because we've got about 1,500 clients that we reshop. There's a special enrollment period, and this most often occurs when someone moves out of the service area. So say they're in Los Angeles, they're on XYZ Medicare Advantage plan, they're going to Idaho. And I'm able to say, well, in your zip code you're going to in Idaho, these are the Medicare Advantage plans you can select from, but also because you're losing your Medicare Advantage coverage, we could move you on to a Medicare supplement plan and upon your relocation to this new state. So moving is one of the main reasons, or if someone is retiring off a group and now is eligible for coverage, we're able to look at them and getting them on a Medicare supplement or Medicare Advantage. An important note here, if you or anyone you know is 65 years or older and leaving a group health plan and deciding to take COBRA, they need to really take a strong look at that, because the moment your COBRA starts, you're no longer on a group plan that is considered primary. COBRA is considered secondary to Medicare. So we've had some horror stories of people that didn't get the right advice, signed up on COBRA because their company was paying for it for the next 12 months, had a major claim, and the insurance company says, well, we pay second to Medicare, but I don't have Medicare. Gee, not our problem. We only pay after Medicare pays. So it's essential that anyone you know that's on COBRA and over 65 takes a good hard look at that. There's an open enrollment period that goes January 1st to March 31st. This has a specific purpose. It's mostly designed for someone who's on a Medicare Advantage HMO plan and they realize that they're not on the right one and they want to switch to a different one. You can make a one-time change. You can also disenroll from a Medicare Advantage plan, go back to basic Medicare, and add a standalone Part D prescription drug plan. So the question that often comes up is, when can I change from a Medicare Advantage HMO plan onto one of those Medicare supplement plans? Either I'm not happy with the HMO experience, or I've got a health issue that I want to go to this specialist and they're not part of the network. There is no annual enrollment period for Medicare supplement plans. Your enrollment period starts when you get Medicare Part B and goes for 6 months. So I have many people that are shocked when I tell them that that's not an option during the annual enrollment period, that they can't simply change back to or change over to a Medicare supplement plan every year. You have to wait for an open enrollment period, and then you have to answer health history questions in most cases to get onto a Medicare supplement plan. So I admonish people when they're first going on a Medicare and first selecting a plan, think not only in terms of the plan that you want right now, but also the plan that you might want to have in place 5, 10, 15, 20 years down the road. And about 80% of the people we talk to end up enrolling in Medicare supplement plans, which I think gives you a much greater latitude. And when you get really sick, it has many more options available to you in terms of providers, in terms of skilled nursing, in terms of therapies. California has a birthday rule. Now, this is only for people that are on a Medicare supplement plan and they're coming up on their birthday. They have the guaranteed right to change to any company's similar or lesser Medicare supplement plan within 60 days of their birthday without any health questions, and they cannot be turned down. So this gives us an edge for people that are in California, is when we're shopping rates on carriers, we only need a 12-month time horizon, because we know that on their next birthday, we can change them to another plan if the one we chose initially is no longer competitive. So it's important to know that if you don't sign up for Part D when you first turn 65, and you don't have group coverage that has creditable Part D plan, then you're subject to a penalty. And that penalty is accrued every month that you don't have creditable coverage. Now, it's only about 30 cents a month, but it does add up over time. So I've got a couple of clients that are paying their Medicare premiums, their Part D premiums, their Medicare supplement premium, and a penalty of $58.10 a month that they will pay for the rest of their lives. So anyone that's turning 65, it's something they need to look at and determine whether they've got creditable coverage or they need to enroll in a Part D plan. Fewer and fewer people I talk to have retiree health plan options. There are still some, and LAUSD has a lot of retirees in the Los Angeles area. 95% of the time when I talk to someone that's got a retiree health plan, I have no compelling reason for them to change to something else. I do occasionally run into people that are paying a ridiculous amount for a not very good plan, and then we obviously move them to something else. But retiree health plans, most often, if you leave the retiree health plan, it's a one-way door and you never get to go back in. And those plans typically have a more robust drug coverage than I can get for people on a Part D prescription drug plan. So it's a palate cleanser. Here's my cartoon for the day. So medical technology has done wonderful things. I'm wondering if it'll ever get to this point, but I don't think so. Jerry, you can laugh again. There you go. Okay, Medicare cost assistance. So if you or anyone you know has a challenge paying the Part B as in boy premium or the expenses or drug costs, there's probably assistance programs that are available to you, and we encourage you to take advantage of them. I can't tell if Jerry has texted me something that I need to be aware of.
Just 12:30.
Please stand by. There you go. We'll get that better next time. Okay, so there are state and federal programs that can assist you. If your income and assets are low enough, you can qualify for Medicaid, or in California, it's called Medi-Cal. You have to have less than $2,000 in assets to qualify for that if you're over age 65. And there's also programs that are lesser thresholds to qualify for, and that would be low-income subsidy or extra help that will help people pay for their prescription drug costs and mitigate that. I've seen dramatic changes from someone that was going to have to pay $3,000 in drug costs. It dropped down to $200 a year in drug costs. So encourage anyone you know that's having difficulty paying for the drug costs or paying for their health care to explore their eligibility for Medi-Cal, Medicaid, Medi-Cal, or extra help. If they've done everything they can and they don't qualify for Medi-Cal and they don't qualify for extra help, we've got an organization that we support called the California Health Advocates, and they put together this fact sheet every year of strategies and ways that people can reduce their drug costs. One that we use is a website called GoodRx. Now, I'm not giving you an endorsement of GoodRx, but we have shopped them occasionally and find pricing remarkably lower than what some of our clients are paying on plans that they're paying a premium for. So it's our reality check. This document has 4 pages, has a plethora of ideas to explore if someone is truly challenged on what it's costing them to pay for their prescription drugs. So have you done your yearly Medicare plan review? One of the things that we do for our clients, and as far as I know, I don't know of any other agent or agency that's doing this. We offer to shop their Part D prescription drug plan initially, make a recommendation. Then we offer to review that Part D prescription drug plan every year during the annual election period, and every year we move about 20% of our Part D clients for compelling monetary savings. In addition to that, if they're a client of ours for Medicare supplement plan, we review that plan every year automatically around their birthday to see if there's a more cost-effective plan or a plan that makes more sense for them. And we've saved people thousands of dollars a year by doing this. And in aggregate, I know we save people tens of thousands, if not hundreds of thousands of dollars in cost by reviewing this. So anyone you know that's on Medicare, we strongly encourage they review it once a year just to see if there's something better in the marketplace. So reality check ahead. If you or someone you know is on a Medicare supplement plan, we publish this rate chart. This is an aggregate of 10 different companies that we work with, and we look at all the different ages that we have represented here and look for who has the least expensive Plan F, Plan G, Plan High Deductible F in the marketplace. And we'll tell people, well, just look at this chart and what's your age and how much are you paying right now? And I've had someone that looked at this chart and said, how come I'm paying $100 more than what your chart shows? I think you should get together with us and we should take a look and see what's going on and if there's a change to occur. So we encounter this all the time where people are overpaying, sometimes only $30 or $40 a month, but sometimes as much as $600 a month for their Medicare supplement plan. So again, it's prudent to shop periodically. We've saved people lots of money. Changes in 2020. So Medicare Supplement Plan F and Plan C are no longer available if your birthday is after January 1st, 1955. So they've sunset those plans. The richest plan now for someone that's turned 65 this year is a Plan G as in George. The only difference is that Plan G has a $198 deductible and the rates are lower. There's no other change. We're actually systematically moving lots of our clients from Plan F to Plan G. If you turn 65 before January 1st of this year, you can stay on your Plan F. You can continue to enroll in another company's Plan F. You have those options available to you. I want to talk a little bit about Medicare Part D. This came out in 2006. It's a convoluted, complicated, compromise plan that far exceeds what existed previously, but you can pay 4 different prices for the same drug during the course of a year while you're on the same plan. So there's some moving parts. There's a deductible. Some plans will have a deductible. There's an initial cost that can be either a copay or a percentage. There's the coverage gap, formerly known as a donut hole, which all drugs you're going to pay 25% for. And then after you hit catastrophic coverage, where drugs you purchased at the retail price of $6,350, your cost drops down to 5%. So I always liked this illustration of the Part D donut hole when it first came out. It makes me want to have a donut, but that's they called it the donut hole because of the gap in between in the middle there. We shop every year for our clients on Medicare.gov. You can do it yourself. Go here, you tell it what plan you're looking for, you list all your drugs, you list your pharmacy, and it will show all 32 Part D prescription drug plans ranked from least expensive to most expensive on an aggregate cost. You can also look up Medicare Advantage plans and you can filter them. There are again 55 Medicare Advantage plans in Los Angeles, not counting some special needs plans, and you can filter it by a number of different attributes. So if you're looking at a Medicare Advantage plan, what I challenge people is, are you comfortable with the structure of the plan? Are you comfortable with an HMO? Are your doctors contracted? Are your drugs covered under it? Are the hospitals that you want to have access to included in the network? What's the maximum out of pocket? Maximum out of pocket on a Medicare Advantage plan can be as low as $800 for the year and as high as $10,000 for the year. And then what services do you anticipate you're going to need? So if I have a client that says, I'm really going to need a hearing aid, well, let's try to put you on a plan that incorporates that benefit as well. And then what's the overall star rating for the plan? So the government has star ratings that they assign to all Part D and Medicare Advantage plans. 5 is the highest category, and they have 44 individual items that they measure that then they aggregate into the overall rating. Most of the Medicare Advantage plans we work with have a 4 or 4.5 star rating, And it's not the only attribute we look at, but it's certainly something we do incorporate into our recommendation. If a plan is less than 3 stars, we want to stay away from it because that's a red flag. If you're on Medicare, you have access to a plethora of preventative services at no cost. This is out of the Medicare You book, and there's 2 pages. And I tell people, take this into your doctor's office and say, what haven't I had done? What do I need to have done? If you're going outside of the United States, Medicare has no coverage outside of the United States. There are some Medicare supplement plans that offer up to $50,000 lifetime in benefits outside of the United States. And most of the Medicare Advantage plans also include worldwide coverage in their benefit. My default recommendation to people is if you're traveling outside of the United States, you might want to look at some travel accident coverage that would include evacuation and would also be the first payer, so you don't have to worry about submitting claims to the insurance company. We have some brochures available. If you email us, call us, let us know, we can send out to you for someone turning 65, a lot of the information that I covered in this presentation. And we can also send out to you a flyer such as this if you want as a point of reference, if you're trying to help someone determine if they're paying too much for their Medicare supplement plan. So there are a lot of factors to consider before enrolling in a plan. We look at the doctors you want to see, the prescriptions you're taking, what your budget is, what your travel habits are, what your likes and dislikes are. As an independent agent, we're contracted with about 20 different insurance companies, and we help try to navigate the waters for you to figure out what plan fits your circumstances in the best way possible. We do not charge anything for our services. We're paid a commission by the insurance companies, so you're going to get the same cost as if you called a toll-free number or enrolled online, but you're going to get the benefit of our knowledge and our help, and also we're going to review your coverage every year. Okay, so we have time for questions. Jerry, have you any questions that I should address?
Not yet. I've been answering some questions already.
Okay, so what time are we at right now?
12:40.
All right, so I have a bonus segment that's going to be a little more drilled down, a little more into Medicare supplement plans. So if you have questions, put them in the chat room right now. It's only going to take about 5 or 7 minutes. If you want to stay with us for that, you can. If you decide you don't, then if you could put something in the chat room and let us know if this was what you thought it would be and any other questions you would have. So, hey, Jerry, can you see everyone that's participating?
Yes, someone want to know a little more information about the donut hole.
Okay, so the donut hole, I'll go back to that. So if you're on a Part D prescription drug plan, when Part D first came out in 2006, you'd have a copay for the first $3,000 worth of drugs that you purchased, and then you went into the coverage gap or donut hole. And in 2006, that meant you were paying 100% of the cost of your prescriptions. So the first couple of years Part D was out, I got a phone call every single time someone went into the coverage gap because, Paul, what the heck's going on? Last month it was $130 for my drug. This month it's $740. What the heck's going on? I'd say, well, you know, we talked about this. This is how Part D works. This is how, you know, that operates. We knew this was coming. Okay, fine. But next year I want a better plan. No, we put you on the best plan we possibly could based on your drugs. So over the years, that coverage gap has dropped from 100% down to 25%. So what we see now is when people move from the initial coverage level and they've hit a threshold where they've purchased drugs with a retail price of $4,020, sometimes the cost goes up a little, sometimes the cost goes down a little when they go into the coverage gap. But it's not the dramatic impact it was when Part D first came about. So the key to this is every year during the annual election period is to update your list of drugs, shop all the Part D plans that are in the marketplace, and see if the plan you're on is close or there's been a new carrier that's emerged that is being much more aggressive in their pricing and you can save a lot of money. That's the only time you have the chance to make a change. During the course of the year, you can't change your plans. However, If you find that your drug cost is excessive, there are some appeals that you can do. If you have a drug that's not being covered, you can appeal and ask it to be covered on the plan formulary. If you have a drug that's excessively priced, you can appeal it and ask it to be reduced to a lower drug tier. Does that, hopefully that addressed the questions and concerns on Part D? Okay. So do I go to the bonus round, or do we have more questions on that I need to address?
I think we've answered most of them.
All right, so it's going to be quick. So bonus segment on Medicare supplement strategies. So the majority of my clients are on Medicare supplement plans. It's been an interesting marketplace the last couple of years. January 2018, Anthem introduced the innovative plan. They reduced their price on their top of the line Medicare supplement plan, and they added in dental and hearing benefits. Then in August of that year, HealthNet introduced a similar plan, similar benefits. And October of 2018, Blue Shield, not to be left out, reduced their rates even further, added dental, added vision, also added a personal emergency response system. So it's the last couple of years, we've been moving people to less expensive Medicare supplement plans, which just makes my day. It's been a lot of fun. So which Medicare supplement plan to choose? So the government has highly regulated Medicare supplement plans. So if it's a Plan F, it's a Plan G, anywhere in the country, the benefits are identical. The network of providers is identical. So what we find is we're mostly just shopping price and to some extent name brand recognition of the company. Currently, Plan F is available to some folks if they turn 65 before January 1st of this year. Plan G is the plan that we're mostly enrolling new people in. So, strategies for Medicare supplement plans. When you enroll at age 65, we're looking at who provides the best value, and a number of companies offer a new to Medicare discount the first year. Then we reshop every year, and oftentimes we'll move people to another plan, another carrier, and we're almost certainly going to move them to another plan within 10 years of turning 65. So this is a little out of date, but my strategy here is I put them with company number A at age 65, and versus company B, they're saving this much every year. But then at 75, I move them over to company B, and you can see with company A, the rates go up. On company B, they don't go up as much. So we look at, if we do it right, we've saved someone about $1,600 the first 10 years and aggregate about $3,100 over the 25-year time period there. We are constantly looking and reviewing and trying to figure out the best deal for our clients. So it doesn't make sense to stay with one plan forever. It makes sense to look around and shop. So if someone's new to Medicare, both parties new to Medicare at age 65, this is just some representation of what the rates are. And on Plan F, again, they'd have to both be 65 before January 1st of this year. This is the range of prices. And people say, how come there's such different prices? Well, different companies have different plans and different strategies. And you can see if I put someone with one plan, they're going to be paying $475 a month versus the plan I think they should go with, $253 a month. And this is across the board. This is why for every person we talk to, we look at a variety of companies. And this is now what's occurred this year. Plan C and Plan F are only eligible. You're only eligible for those if you turn 65 before January 1st, 2020. But we still have 1, 2, 3, 4, 5, 6, 7, 8, 9 plans to choose from. Most of these plans, I don't find a reason to enroll people in the Los Angeles area. Perhaps some other states and counties there are, but in Los Angeles, it's mostly Plan G. Some plans have a discount rate if you have 2 members at the same address. Again, there's new to Medicare discounts from most companies. There's one company that offers a 12% discount if you just reside with someone who's over age 60. Many companies offer a discount if you set it up on a monthly bank draft, and some plans offer a discount if you pay annually as much as $48. Also, timing when you started your Medicare Part B will set a time frame for one carrier, and if you apply within 10 years, you're in one category rate, and if it's more than 10 years, a different category. We take all this into consideration when we're making a recommendation. And suddenly everything went blank. I think that means I'm at the end of my presentation. Okay, so any more questions, Jerry?
No, I'm taking care of most of them here.
Okay, so we answer lots of questions. If you just have someone that's turning 65 and you're concerned they're not doing the right thing, just have them give us a call. We're not going to talk them into anything. If they've got a good group plan and they're not paying much for it, we're going to say stay with what you've got and then call us in 5 or 10 years whenever you decide to retire. I thank you all very much for attending. If you have a chance and can give us some feedback in the chat box, we'd love to hear what your thoughts were, whether this is what you thought it was going to be, if there's a topic we missed. Since we can't have you all talking at once under Zoom because it just becomes chaos, we've had to rely on the chat room for that. So again, thank you all for attending. I'll stay on the line for a few more minutes in case anyone has any questions I can answer. I'm reviewing the chat box. I thank you for all the favorable feedback.
Paul?
Yes.
Someone is, the question is, my friend's turning 58 and became disabled starting SSDI. Does he qualify for Medicare?
Once he's been on SSDI for 24 months, he will automatically be enrolled in Medicare. That should answer the question. If it doesn't, call me. So I think we're going to, we did record the meeting. I think, Vince, you were going to look at it and see if it was usable as something that could be posted, but I'm going to defer to you.
Yeah, we will. If it's able to be posted on the website, we'll do that. If not, do you by chance have a copy of the slide presentation that you make available to people?
Yes.
Yeah, so they can request that directly from you.
Yep.
The slides. Okay, very good. That would probably be the first choice until we find out about the other. Okay.
Okay.